Welcome to the Long COVID podcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to this episode of the Long COVID podcast. I'm delighted to be joined today by Lalita, who is here to share her recovery story. So I'm going to hand straight over to her and say, Lalita, thank you so much for being here. I'm excited to hear your story and welcome to the podcast.
Thank you, Jackie. Thank you. I've been excited and looking forward to sharing. So yes, I'm Lalita and I live in Tasmania. It's a little island way down south of Australia. I'm a neuroplasticity coach and I've just recently trained with Dr. Howard Schubiner and his team and it's just been fabulous, really fabulous. So my COVID story, oh my goodness. My first bout of COVID was before we actually knew it was COVID. So I had just come back from a very big conference with lots of people in another state, and I was horribly sick, really sick. And I wasn't getting many flus and colds and things leading up to that, but just so ill for about 6 weeks, coughing and just feeling dreadful. And then we started hearing all this news about this COVID, you see. And, Australia was going into lockdown. Our little island went into lockdown. And at the time, we had a hotline, and the family was saying to me, I think you should ring up and see if you've got this COVID. And of course, they ask the questions, have you been with anyone overseas who's come back from China? And, a couple of questions like that. And I said, no. But I had just been to this conference where there was a lot of overseas people. So there was no tests or anything back then. So I was really sick, but I recovered. And I didn't realize until the second time I got COVID, which was in August, end of August 2024. And then I started getting all these other symptoms. I think I had some things left over from the first time I got it because my blood pressure had gone up. I was on blood pressure medication, which really shocked me because I had always had very low blood pressure. And suddenly I've gone from low blood pressure to high blood pressure. And I thought, what the heck's going on here? I just accepted it and just started on the lowest dose of blood pressure medication. And all the time I had these numb lips. And I kept asking the doctor, why have I got these, my lips every now and then they go numb? And he said, oh, that's just your blood pressure. So, okay, I just accepted that. And I was a little bit more tired than normal. I was needing to take naps in the afternoon, which I hadn't done before. And so that I realise now was left over from the first bout. So what happened this second time, very mild case, just felt like a cold, but then these symptoms started to appear. So the very first thing I noticed was the tachycardia. My heart's racing for no reason whatsoever. And that concerned me. And then not long after that, all these other symptoms just started to just one after another, you know. Suddenly I'm dizzy. Suddenly I have vertigo. Suddenly I can't lie down flat. My head's spinning. So I'm having to sleep sitting up on 3 or 4 pillows because if I try to lie down, I'm just spinning out. And then my legs and my arms feel like lead. I go to stand up and very heavy feeling in my legs and my arms and this tightness in my chest. Unbelievable. So, yeah, the symptoms just kept coming and kept coming and kept coming. Now, luckily, because of my training and because of the work that I'd been doing, and by this time really understood all the long COVID symptoms. I've been following it all fairly closely because a lot of my clients had these symptoms. So as I was experiencing them, I knew exactly what it was. And luckily for me, I knew what to do. So I didn't have to go down the rabbit hole like I see so many people doing, chasing up, you know, could it be this? Could it be this? Will this work? Will that work? I knew straight away this is my autonomic nervous system. It's affected that. And that's why I had probably about 30 different symptoms. My gut was affected. I had headaches. I had muscle aches and pains. I had this kind of stabbing pain in my body. So every now and then I'd feel like someone was stabbing me in my right breast and then in my spleen and then in my ovary and then just this very, very strange symptoms. Yeah, brain fog, this costochondritis, this tightness across the chest. And then one day I was at the dentist and suddenly I had to get up. I had to tell them to stop because I went into complete panic. Get me out of here. I couldn't breathe. So this air hunger had started out of nowhere. I'd be in anywhere that was confined space where there was no window, I would feel like I couldn't breathe. And that was a horrible feeling. Again, I realized after the first time I got COVID, suddenly I would get claustrophobia if I'd had to have a scan. And I didn't put that together that it was part of this long COVID until the second time I got it. And then the penny dropped. I thought, oh, okay. And then I had my first trip into emergency because I had this chest pain that no matter what I did, it just would not go. And I went through the night with it. And first thing in the morning, I rang a friend of mine up who's a nurse practitioner and I said to her, can I ask your advice what I should do? I don't want to ring the ambulance up because I don't think this is a heart problem because by that time I'd already been to see the cardiologist from that tachycardia. I'd had all the tests done. I'd had my bloods done. I'd had thyroid, hormones, all the tests that you could possibly do after those first initial lot of symptoms. And the doctors had no clue. They had no idea what was going on. They just kept telling me, you're perfectly fine. All your tests are fine. There's nothing showing. There's nothing wrong, which I know so many people get told. But I knew something was wrong. And so she suggested I go with the ambulance. And of course, as soon as they arrived and they put on all the little pads on you, heart's fine, there's nothing wrong, but we still need to take you to hospital. So I go to hospital and I'm there. And the doctor's there again, no help whatsoever. Oh, I think it's anxiety. And A friend of mine was with me who knows me so well. She's known me for a long, long time. And she just looked at this doctor and she said, "You don't know Lalita. She's the most chilled out, calm, relaxed person that you'll ever meet. I don't think I've ever experienced anxiety in my life, apart from normal fears that you have. Never experienced anxiety because I've worked in mental illness. I've seen people with anxiety know what they go through, and that was not me. So I wasn't very happy coming out of there and being told it was just anxiety. The only reason I went was because it had to do with the chest, and I was paying my due diligence and thought I'd better go. Two other times I ended up there, same symptoms, same. And because it's the chest, anything chest pain, and I guess being my age as well, I ended up going. Same story each time.
You're totally fine. There's nothing wrong with you. Well, there's nothing wrong with you that we can find. You're coming into this in a slightly different way to how I did. And I think a lot of people possibly come in the same way that I did, where we've never heard of the nervous system, no understanding of it at all. And that comes through the experience of long COVID and starting to understand and starting to find other things. So it's that kind of, yeah, learning about it through the experience. Whereas you came into the experience of long COVID already having an understanding of the nervous system. Did you ever have any doubts? I mean, you've said that you went through all the battery of tests and, you were able to confidently say, these doctors have checked me out and they can't find anything structurally wrong. But, and that must have helped, I imagine. But did you have doubts about whether, is this really what it is? Is the nervous system really this powerful? Can it really do all of these things? Is it really the underlying thing? Or were you very totally sure about it?
100% sure because I had a long history of chronic illness before. And the way that I recovered from that was using nervous system. And a lot of these symptoms that I was experiencing were ones that I experienced back there, right? So the dizziness, the POTS type symptoms, and eventually I got diagnosed with dysautonomia because I had that umbrella, of all those
Yeah.
symptoms, dysautonomia. But no, 100%. But also what I had learned from my previous recovery, and that's what I did this time. So I decided, okay, I know what's going on, and I'm going to do exactly the same as what I did last time to recover. And I think that's why I recovered in the 12, 13, 14 months max. I was fully recovered. The last thing to
Right.
go was tinnitus, which was interesting. So everything else, the POTS went fairly quickly, the digestive issues went fairly quickly, because what I did was I used a combination. So yes, I knew it was nervous system, and that was my number one go-to during the whole process. From the first day I got symptoms, I was straight into my nervous system tools. So it was a blessing to me that I had them and knew them, and knew myself as well. I really understood my personality, my traits, my self talk, my thought process. I was very, very aware of those. So I was able to get into that work quite quickly, and then combined it with the next thing I did was I went straight to my naturopath, and that's where I got all the supplements from. So she put me on a host of supplements, like straight away. I was on the nattokinase and the dandelion tincture and the stinging nettle tea, quercetin, black seed oil, all the vitamins, the antihistamines, saltwater therapy, prebiotics, probiotics, curcumin, the whole list of things. I just started incorporating those to help with the immune system issues, to help with the gut issues, to help with the hormonal issues. So everything that was being affected, all the systems of the body that get affected with long COVID, I started on that.
Yeah. That was under the guidance of, you said, a naturopath. So it was targeted.
Of my naturopath, a very good naturopath who I had been seeing before when I was ill
Hmm.
and completely trusted their knowledge. So that was a bonus, a big plus for me. And then after that, I started Bowen therapy because I had a lot of aches and pains. And again, I'd used Bowen therapy before previously. And I used bioresonance therapy to check for any spike protein or any, because I had been hearing from people that, herpes were activated, Epstein-Barr was activated. And yes, absolutely all of that was happening when once I started the bioresonance therapy, that all got picked up. And I was really surprised. They also picked up that I was anemic, that I was low in iron, which I had never been before. I've been a vegetarian most of my life, and I've never had an iron anemic problem. So something was happening in my circulation system. My blood supply system was getting affected as well. So onto the iron tablets as well as all the herbs and all the supplements. So bioresonance was amazing. Bowen was really amazing. And then later on, I added craniosacral therapy. Everything was coming back to let's support the nervous system. Do whatever you can to support the nervous system. So it was, and yoga nidra every night. And if I had to have a nap through the day as well. Um, Making all those dietary changes to support the gut as well as the supplements. So really small meals and no carbohydrates and a very paleo type um, diet to support my gut as well. A combination of whatever is going to help support my body, my nervous system, and then using the mind body processes, the nervous system processes to support my mind and my emotions. The emotions, the roller coaster of emotions that you go through, right, Jackie, on this journey.
It's quite a roller coaster, isn't it? Absolutely. Now, I'd love to hear more about your nervous system practices and the sort of emotional support and all of that. Before we do that, I would love, partly for my own curiosity, because it hasn't really come up, but the bioresonance. Can you say a little bit about what that is? Because I don't think anyone has mentioned that before.
Amazing, amazing. It's been around for probably 30, 40 years, mostly in the European countries. I believe it's really big in Germany, where it may have possibly started, and Poland and a lot of those European countries have all been using bioresonance for many, many, many years. I came across it when I was ill before, because I went down the rabbit hole of, because I had lupus and fibromyalgia, chronic fatigue, chronic pain, and all these other illnesses. And a lot of the practitioners I was seeing were telling me that, it could be a virus, it could be dormant viruses, it could be. So we went down that rabbit hole, and the bioresonance machine is one that picks up on that. So it checks for viruses, bacterias, chemicals in the body, worms, those lovely worms that they find in people. So it's this little machine, but basically it works on frequencies. So everything resonates on a frequency, okay? And we as human beings resonate on different frequencies. So it's like, I guess, like dogs, they can hear something and we can't. They're on a different frequency to us, right? So everything has a frequency. So every virus, bacteria, fungi, all these things are on different frequencies. So the machine checks that against what's happening in your body. So it can tell you whether you have mold, in your system. It can tell you if you have certain viruses, like mine showed up. And it was interesting because the practitioner that I saw this time, I hadn't seen her before. She didn't know my history at all. And when she said, "Oh, Epstein-Barr showing up," I said, "Oh, that's interesting because I haven't had that for, 30 years." Here it was showing up again after COVID. And herpes. She said herpes is showing up again. I hadn't had that for years. Last time I was tested, so I get tested fairly on a regular basis with this machine because I want to stay really well. I want to stay healthy, and so the basis of it is that if you can eliminate or reduce a lot of these layers of the toxins and the viruses and things in your body has a better chance of healing. So that's basically why I wanted to check it and I wanted to do it. I wanted to know, have I still got the COVID virus, in the body? Is it still floating around there like Epstein-Barr does? Just stays there dormant. Herpes stays there dormant until you're under a bit of stress. Shingles is another one. So many people getting shingles now. They're under a bit of stress. They may have got COVID, and boom, up comes the shingles, right? So it's very similar. So I wanted to check that and make sure that that wasn't going to hinder of me using the supplements and everything else that I was doing. I wanted to really give my body the best chance of healing. I wanted to put it into that healing state, which included, really good sleep and good hydration and really nourishing foods and that lovely yoga nidra that just calms your spirit and your soul whilst you sleep.
Yeah, I was a big fan of yoga nidras as well. I used them a lot. It was about the only thing that
Mm.
I could find at the time that would help my mind to calm down, because I have a very busy mind, still do, but I have a little bit more space for it nowadays. Um, but yeah, this bio, isn't it? Sounds really cool because it sounds like it works as that kind of almost like a diagnostic, but also then something that you can use against that. So that's kind of cool.
It does. That's right.
Wow, that is amazing. Yeah, and I don't think anyone has mentioned it before, which is why I thought, oh, let's find out a bit more about this. That's amazing. I love what you were saying about kind of creating this environment in which your body was going to heal as well. Because like I hear this from so many people, and it was my own experience as well. There isn't one thing that's going to help. It's about finding a whole host of different things that's going to help. And some of that is making sure that your environment is as conducive to healing as possible, whether it's, the space that you're in, whether you're eating and drinking stuff that's good for you, the air that you breathe, and then what we consume in terms of things like social media as well, which is a huge influence nowadays, isn't it? And this kind of our environment is more than just our physical environment, I think, isn't it? And I love that you've been kind of pulling in lots of different things where you said, okay, well, this is nervous system, but also the nervous system doesn't work in isolation. So what else can I do to support my body, whether it's supplements with your naturopath or the bioresonance and the other things that you've been talking about? So it's this kind of like multi-pronged approach, isn't it? We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Vicky Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us.
That's right, which all end up actually supporting the nervous system. All of those things. It always goes back to that central autonomic nervous system because that's in charge of all the systems of the body. So why not help it along? And I think it's really it's about self-love and self-care when you do things like that. And it's going to be different for everybody. Everybody will need different support systems. But at the end of the day, I think it's really about caring for yourself and putting yourself first and really putting in that effort, to give yourself every chance of recovering. And I was determined to, I had this total belief that I was going to fully recover. And I think that was helped by the fact that I'd recovered from all these other, hideous illnesses in the past. I'm like, if I can do that, I can do this. So I was just like really pulling all the tools out of my toolbox again that I hadn't needed to for a long time. You know, there's some things that I've just always used in the last. So I was well for 14 years, right? Fully recovered, well for 14 years, and then developed long COVID. So I hadn't needed to use, like, I don't think I'd had a Bowen therapy for years. And or even, gone to naturopaths for supplements, and a lot of these things I hadn't done. They were all on the back burner because I was so well. The thing that really, really, I think, propelled my healing more than anything else was the breath work. Really, that was my nervous system go-to. And I wanted to share that with you and tell you just what an impact that had. So, for example, as soon as I started noticing that dizzy feeling and the vertigo, and, I couldn't look up, I couldn't look down, everything was spinning, I would go to my breath, immediately go to my breath. And 3 long, slow breaths, that would pass. And that was my proof, like, okay, this is working. So that's going to be my number one go-to. Whatever symptom that I had, even those visits to the ICU that I had with the stabbing chest pain, I continuously used my breath during that whole time. And I'm pretty sure that's what helped me to stay calm, to not buy into the fear so much, and just ride out these waves upon waves of different symptoms that were coming, like 30 different symptoms. That's what really was my number one go-to, was the breathing techniques. I used them in different ways. I would use the 4 in and 6 out. And then I would also do what my grandchildren call the sniff, sniff poo. I'd use that one when I felt like I was going into a little panic or a little anxiety. I would use that one. But most of the other times I would just use the 4 in, 6 out. But what I did was at the same time I added to it, and I don't know whether you do this or not, but this is where the nervous system tools came in as well. I would use the self-compassion, the self-talk. You're going to be okay. everything's all right. Everything will be fine. This is just your nervous system. You're not in danger. So I would do the breathing and the self-talk combined. And that worked very, very well for me with and look, sometimes it was 30, 40 times a day. I would have to do it. I'd be in the kitchen cooking something and suddenly I'd get the air hunger. And I'd go over to the window, open the window, and I would breathe and I would do the self-talk and I would just feel myself relaxing. I'd notice my nervous system just regulating again, right? Yes, yes, going from really activated because the air hunger really clicks on that fear response. You just don't think you're going to get the next breath. So every single symptom that I'd have, I would go to the breath, go to the breath. And another one I used was breathing and tapping. So I had done a lot of tapping before when I got well. So I combined the three, tapping, breathing, and the self-soothing all together. And that got me through some really difficult, challenging times as well, when the symptoms were, very high.
I love this because, like, the first thing that we find that really helps is so powerful. I mean, you said that, you understood what was going on and you had this belief that you would get better. And even so, having that kind of, oh, this breath practice that I found, this helps me. Each time things start getting really challenging, I can do this and it will help. And it's not solving every single problem I have in the world, but it is helping. And you kept coming back to that and then stacking it up and
Yeah.
adding in the self compassion because the breath doesn't work in isolation. We are, whole body beings, aren't we? So you're bringing in these other things alongside the breath work,
Yes.
which is, amazing. And the fact that it made you feel slightly better and helped you through some of those really challenging times is what's the proof in the pudding, isn't it? That it was helping, which is awesome.
Yeah, I found that those in the moment tools were really what worked the best,
Yeah.
you know, and having that understanding of working from the danger response understanding that,
Mhm.
I'm experiencing this symptom right now because my nervous system is perceiving some type of danger. Now, that danger might be that the virus is still there. Um, it may be that um, this feeling that I'm not getting any air, that my blood's rushing to my legs when I stand up, that my head's throbbing, that my heart's racing. All these symptoms that I was feeling were signaling danger to my nervous system. So then my nervous system is ramping up that fear. So Dr. Schubner's the 5 Fs, which are now 7 Fs, but there were 5 to start with. you know, I I really use those to my advantage. Am I fearing this symptom right now? When I'm not getting this air hunger, am I in fear? I've got this throbbing pain in my head. Am I focused on that? Right? Am I feeling frustrated with having to constantly do this breathing and constantly having to stop and do some tapping, do some self talk, go over there and have another glass of salt water and just all these things, that I was constantly having to do. Am I frustrated about that? So the 5 Fs were really getting me in touch with what was triggering my response. And then I was very much aware of I must bring safety to my brain. I've got to give safety messages to my brain constantly, consistently. I believe that that's what got me through. Just
Yeah.
being relentless in my every single symptom, just go to the breath, go to the breath, go to the breath. Do some tapping and breathe. Do some self compassion and breathe. And they passed. And then I had lots of proof. So each time I had a symptom, I used the tool in the moment, it would pass. I had proof. So my brain was building up all this proof that, she's not in danger. She's not in danger. She's safe. She's okay.
We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much. So it was that awareness and then building the strategies or finding the strategies that worked for you and then employing them consistently, every time over and over and over.
Yes, yes.
Did you sort of find, I suppose this is a sort of two-parter, did you find that things sort of did consistently start to improve? And then what did that kind of final off-ramp up to that full recovery kind of look like for you?
I was amazed. I was amazed when suddenly all the pot symptoms were gone. It's like, really? Pe- People are telling me that they've had POTS for 6 years and when I was sick before, I had POTS for years. So I went, really? So quickly? That's amazing. It's got to be what I'm doing, this combination approach of what I'm doing. So there's proof more for my brain. No more visits to emergency, just those three. And all the symptoms were just melting away one by one by one. Sometimes I wasn't even realizing that they were gone, you know? And when I started to think about them all and write them down before I spoke with you, I was like, oh my goodness, I'd forgotten that. I forgot what that was like. Yeah, yeah. So they were just really just going, going, going. And like I said, the tinnitus was really the last thing to go. And I believe the antihistamines helped a lot with that. And again, I went to the audiologist. I had everything checked out thoroughly. Anything that I thought I've got to do my due diligence here and have it checked and tested. And because then I could cross that off. I could say, okay, I've done that. I know it's my nervous system. That's why I have this tinnitus. So I'll just persevere, just keep going. So I did a lot of somatic tracking as well. It was interesting because in the back of my mind, I kind of said to myself, okay, you've got this thing. You're only going to have it for 12 months. Give yourself that, and then you're going to be dusted, done and dusted. So, so I don't know if I had a placebo effect there as well, maybe. But I'm like, why not? Why not tell your brain that? And believe that you're going to fully recover.
It's really interesting because, I mean, one of the things I get asked so many times in terms of my own recovery, how long will it take? If I start doing this now, how long will it take me to recover? And, I can't answer that question, and you can't judge that question on my recovery, on anyone else's recovery, because everybody is different. And, I think I have always thought until you said what you said that staying away from timelines is helpful. Be curious to things happening, be open, be, to the fact that they can work
Yes.
and, having that hope and belief that things can and will get better. But if we put that timeline on it, you know, it's like deadline, and that deadline adds pressure, and that pressure is, you know, is going to be unhelpful because it's going to make us feel unsafe. And it sort of sounds like you did the opposite, but I'm wondering if the way you did it was in a sort of curious way. It was a no pressure way.
Yeah, no pressure way. Just always a loving, compassionate approach. And that's one thing I've learned from Dr. Schubner's training. You've got to do this work with love and
Mm,
compassion and find joy. You know, keep finding joy in your days, even when you feel miserable and terrible. Find those moments of joy and take the pressure off yourself. Yeah, yeah,
mm.
absolutely. So, you know, if I hadn't recovered within the 12 months, I would have checked in with myself because that's what the emotional work is about, you know. I check in with myself. How am I feeling about that? I'm a little bit past the 12 and I've still got a few symptoms here. I would just go really easy on myself. Right? It's okay. I know it's not far off. I've only got a couple of symptoms left. Look at all the symptoms that have gone now, you know. So I just do that self talk again, reassure myself again, and just focus back on what I needed to do, which was just keep doing what I was doing, you know, keep following this routine.
So, yeah, you were able to kind of not put pressure on yourself, but also, I mean, I think what often is the danger is, you know, you say, oh, that person's been ill for 5 years. I can't do that. So it's that kind of, you know, I won't necessarily be ill for that long, but I'm also not putting pressure on myself to be better really quickly.
Yes.
So it's that kind of, yeah, middle ground kind of thing. Yeah, that's hard to find. Mm. And you mentioned just then the kind of, you know, emotions, and we talked a little bit about this earlier and then went off on a different tangent
Yeah.
about the sort of emotional roller coaster that comes along with this. You know, which is not surprising when, you know, everything, you know, this takes over your whole life, doesn't it, when something like this happens? So our emotions are obviously a huge part of that. And I would just love to know just, you know, how did you kind of manage to balance allowing emotions to be felt without them overwhelming you?
Again, using the breath. So I use a technique which I teach most of my clients now is a body scan and a self-compassion. So I would, because my awareness is already, you know, really honed because of the previous work that I've done, and I've been coaching, you know, for 14 years and learning about the emotions. And most recently with Dr. Schubner with the EAET, it's all about the emotional processing, right? And so I was absolutely aware of what my emotions were, and I would scan my body, notice the emotion first, scan my body, notice where I felt the emotion. Then I would acknowledge it. Oh, I'm so sick of this right now. I just wish it was all over, you know, if it was anger, frustration, times sadness, you know, like there were times when my family would want me to come out with them and I couldn't go out with them because I knew that I'd have this awful air hunger and this awful lead feeling in my legs, you know, and I just really didn't want to go anywhere. So I just noticed that emotion, where it was in my body, acknowledge it was really, really important, and then go to the self-compassion, right? And do that self-talk. You're going to be okay. You're not in danger. You're all right. This will pass. And just breathe through it. And next thing I know, the emotion will just be right down. And I'd carry on with whatever I was doing until the next time it showed up again. So again, it's that in the moment, you know, doing things in the moment and not letting them pass, not avoiding them, not ignoring them, not trying to get rid of them, just letting them be there, but using the tools to process them, whether it was processing the symptom, processing the thoughts that I was having about the symptoms, processing the emotions I was having, and really diligently doing that consistently throughout the day, every day, and sometimes through the night. Sometimes I'd wake because I had the irritable bladder, so I'd be getting up 5 times through the night and getting so frustrated because most of the time I would go back to sleep, but sometimes I wouldn't, and then I'd be annoyed. And so I would just go to my breath. I would do some tapping and breathing. I would do some self-talk. I would do some somatic tracking, whatever I needed to do to help my nervous system. So my number one goal was, how can I support my nervous system to just, when it's activated, so the emotions would activate the nervous system, the symptoms would activate the nervous system, the thoughts would activate the nervous system. So my job was that I'd given to myself was, you know, bring myself out of that activation as quickly as I could, as easily and as loving as I could, in the gentlest, most compassionate way. How can I do this?
The biggest theme almost that I'm picking out from what you've been saying is the self-compassion, which is something, it's so hard, isn't it? I mean, it's something that
Yes.
I'd never even understood before,
Yes.
and certainly had never been kind
Mm,
to myself in the
mm,
past. Was never aware that I should be, and then certainly wasn't when I became ill because my body had let me down and I was useless. So, it suddenly became a thing that I was aware of, and it was this absolutely
mm.
impossible thing, and yet it is
Yes.
something that is so important. So I think for people who are listening, if you're thinking, well, that sounds impossible, it's very difficult, or it certainly can be. But I'm picking out so much from you, and the way that you speak is how important it is.
Yeah, and you just start off slowly. Start off very
Mm,
slowly. If you can't find that self-compassion for yourself, imagine it's for your child. Imagine it's your best friend. Imagine it's somebody else who's going through that. And what would you say to them? Right. And as you build on that, as you practice that and you do that regularly, you'll start finding ones for yourself, and you start
yeah.
really, really, it gets easier and easier. If you haven't experienced self compassion from others throughout your life, if you've experienced more criticism and judgment and harsh words, which many of us have, many of us, then it is difficult to find that self compassion. But if you just start gradually introducing it and build on it, I often say to people, can you ask your friend what they would say about you? What are the things that they would say that they love about you? And all of a sudden, they've got this list of things that they know about themselves. And I believe that we all have inner strength, all of us. We all have the wisdom, we all have knowledge, and nobody knows you like you do. Right? So I said, trust that, trust you and what you're doing, and listen to yourself. I see so many people out there, they're always listening to everybody else. Oh, this person did this. Why can't I do that? And why aren't I getting better? Just listen to yourself and trust yourself. Honestly, if I hadn't done that the first time I got sick and this time I got sick, I don't think I would have recovered as quickly. So it's just trusting the knowledge that I already had, the knowing that I already had, really helped. helped tremendously.
Yeah. And it sounds like from what you're saying, and again, I've heard other people say that, and I'm coming to realize it myself as well, is that, it could be seen as a journey back to yourself, reconnecting with your body and that kind of,
Yes.
who would I be without everyone else's expectations? And certainly for myself, I don't think I realized how much of my life I was living for other people or in the way that other people thought I should be living it. And I feel like I'm much closer now to living the life that I want. But that has taken a lot of, well, it's taken a horrible, horrible experience of long COVID. And it's taken a lot of
Mhm.
pain and a lot of work. Yeah, it's not something you would have wished for.
That's right. And there was a part of the work that I did following along the EAET um, practice is you kind of dig a little bit deeper under the hood, um, particularly when you notice patterns. So there was a pattern that I noticed when I was sick, where I would be more in fear and panic when I was on my own and I had particularly the heart symptoms. So I noticed that and I thought, I got really curious about that. And I remembered from my training, just look a bit deeper under the hood. What could be, um, causing that, what that could be about. And so I swapped a session because I started to figure out what it was. And I had a session with another practitioner and we had a swap. And I said to her, could you explore this pattern that I have noticed? And sure enough, it was to do with my father because it only happened when it was with my chest, with my heart issues. And because he had died of a heart attack when he was only 48 and he was on his own. So that was the link. And so I was able to just work on those emotions of that and how I was relating to it now. So what unconsciously could have been adding to that fear. And so I was able to process those emotions using the EAET, and that never happened again. I didn't have that symptom again, and I didn't have that fear again. So sometimes you've got to go a little bit deeper. So I wanted to share with you this wonderful experience I had with a client, a young girl who came in to see me. She'd been in and out of emergency. She had all the long, long list of symptoms. She was taking note of all of them. And when she arrived, her father dropped her off to see me because she couldn't drive any longer. She's only in her late 20s, I think mid 20s, and she's telling me that she's not working any longer. She can't go to work. She can't drive. And she's just every day living in this fear of all these symptoms. All the doctors she'd been to told her it was anxiety, and both her parents and her said she's never experienced anxiety before. It's not anxiety. Um, she was had all the tests possibly that she could have done. And so she came to see me. Her mother had contacted me. She knew what I do. And what we did, we used that danger response alert system of the brain, the nervous system work of the brain. And I said to her, tell me 3 or 4 of the main stresses, traumas that you've experienced before COVID and since you've had COVID. And so all we did was we worked on those.
Amazing.
And the next time she came to see me, a week later, she was driving herself. She was part time back at work. She was gradually adding. So, in a very short space of time, just by addressing that nervous system, And I gave her some breathing techniques to do, some other little exercises to do. And, she fully recovered in, I'd say, probably a month max. She had no more symptoms. She's back working full time and hasn't had any relapses. She's perfectly fine. So, it can be different for everybody,
Yeah, that's amazing. And, we've had 2 recovery stories for the price of one today, actually, haven't we? Um, Lalita, thank you so much for coming along, for sharing your story, for sharing so much wisdom. And yeah, just thank you for being awesome.
It's been wonderful, wonderful talking with you, Jackie, and keep doing what you're doing. You're doing wonderful work there, and I'm looking forward to sharing what you do with others.
Thank you so much to all of my guests and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/longcovidpod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. And do get in touch